Reducing the risk of diabetes. Diabetes is a chronic condition that affects all ages. If left uncontrolled, diabetes results in consistently high blood sugar levels, which can lead to serious complications such as cardiovascular disease, vision loss, kidney failure, nerve damage, and amputation. Fortunately, it is possible to remain healthy with diabetes through appropriate management and care. What is diabetes? Diabetes is a chronic condition that occurs when the body loses its ability to produce or properly use insulin, a hormone that controls sugar levels in the blood. There are three main types of diabetes. Type 1. Type 2. Gestational diabetes. Type 1 diabetes is an autoimmune disease. The immune system destroys the insulin-producing cells of the pancreas, leaving the individual dependent on an external source of insulin for life. It typically develops in children and youth, but it can also occur in adults. Type 2 diabetes is a metabolic disorder. It occurs when the pancreas does not produce enough insulin or when the body does not properly use the insulin produced. Individuals who are overweight or obese, physically inactive, or of certain ethnic origins, and those who have a family history of diabetes are more likely to develop type 2 diabetes. It typically appears in adults older than 40 years, but it can also occur at a younger age. Gestational diabetes occurs in pregnant women, if high blood sugar levels develop during pregnancy. Although it usually disappears after the delivery, it increases the risk of developing type 2 diabetes later. Reducing the risk of diabetes. Like other serious health conditions, the likelihood of developing type 2 diabetes can be reduced by healthy lifestyle choices, such as controlling the diet, not smoking and losing excess weight and exercising. Weight loss of 5% to 10%, or about 4.5 to 9 kilograms, 10 to 20 pounds, for a 90 kilogram, 200 pound, person, has been shown to significantly reduce the risk of diabetes. Body Mass Index, BMI. The Body Mass Index, BMI, is a simple, widely accepted way of assessing body weight in relation to health for most people aged 20 to 65. The BMI is a statistical measure of the weight of a person scaled according to height. BMI is calculated by dividing the individual's body weight by the square of their height, kg/m2. Eating a healthy, balanced diet. By eating foods that are rich in fiber, reducing the amount of fat in food selections and adding more fruits and vegetables, a person can help control their diet and maintain or lose weight. It is also possible to decrease the size and quantity of food servings while still ensuring that he or she meets healthy nutrient intakes. Ensure regular physical activity. Increasing physical activity is a key element in controlling weight and reducing the likelihood of developing type 2 diabetes. Physical activity also helps a person maintain better posture and balance, stronger muscles and bones, more energy, reduced stress and continued independent living in later life. Managing high blood pressure, cholesterol and glucose. Diabetes and high blood pressure are often found together. Up to 3/4 of people with undiagnosed diabetes have high blood pressure. Studies show that good control of blood pressure, cholesterol and glucose can substantially reduce the risk of someone developing complications and slow their progression. How can diabetes be prevented and managed? It is possible to control certain risk factors for type 2 diabetes, including making healthy lifestyle choices like eating well, exercising, and maintaining a healthy weight. For individuals with prediabetes, medication can also help prevent the development of type 2 diabetes. Since the causes of type 1 diabetes are not all well understood, no measures are currently recommended to prevent this disease. It is also possible to remain healthy with diabetes through appropriate management and care. Treatment plans and targets are based on each individual's profile, but they all aim to avoid short-term risks of high or low blood sugar levels and to prevent or delay long-term complications. Maintaining a healthy lifestyle and a healthy weight, together with medication to control blood sugar levels and vascular risk factors, are common cornerstones of diabetes management. Living with diabetes. Living with diabetes involves cooperation between the person affected and his or her healthcare providers to monitor and manage blood glucose levels and to ensure that the affected person makes important changes in lifestyle. For all types of diabetes, educating the affected person is also an important part of medical care. Learning about diabetes will give the patient the skills, knowledge and resources needed to help him or her manage the condition. Type 1 diabetes requires the affected person to take insulin by injection, continuous insulin infusion, pumps, or inhalation. Watching your diet and taking part in physical activity are also important. Those with type 2 diabetes may be able to control blood glucose levels by following a healthy meal plan and exercise program and losing excess weight. Those who cannot achieve glucose control may have to take oral anti-diabetic drugs and/or insulin to maintain target glucose levels. Everybody's going to have some degree of health problems, and as we get older, I think we've got to maintain. Please don't forget to subscribe, like, share and comments. Cheers!